It's my feel-good breakfast show.
Welcome back to Feel Good Breakfast Show. This is Expresso on S3, and a critical conversation that you and I need to be having is with somebody who knows all about vaccines and, in fact, getting registered as well. So South African healthcare workers have registered and have been vaccinated for COVID-19, and now at this stage of the vaccine rollout plan, senior citizens over the age of 60 are called to register through the official COVID-19 vaccination program registration portal. Now, earlier this month, it was also confirmed that you can register via SMS and WhatsApp, and we have our trusted infectious diseases specialist and HIV clinician, Dr. Emil Reid, is back in the studio to give us a coronavirus update and to tell us more about the vaccine registration process. And I would implore you, if you have any over 60s in the house, I suggest you get them to the TV as soon as possible so we can give them a step-by-step. Dr. Reid, welcome back.
Thank you, Carl.
It's great to see you.
Fantastic.
I think let's start off with what they would call a scan of what the situation is at the moment when it comes to the vaccination process, numbers-wise, how are we doing on infections, recoveries. I think it's important just to start there. So exactly. The rollout, I think in the media, staggered is a word that's really come through quite thick and fast, because it looks like the rollout is a bit slower than we expected. But what are we looking at the moment?
Well, I think the main thing for us is to remember that we're trying to vaccinate people in the middle of a pandemic. And yes, that's always difficult. Currently, we're sitting around about 47,000 active cases of COVID-19 in South Africa. Mm-hmm. Western Cape is doing extremely well. So we're probably on the brink of a third wave as we currently speak. Okay. And what we're looking for is to have around about 10% positivity rate with regards to people that test positive and those that do test. And currently we're sitting with 9% being positive. Certain parts of the countries, i.e. Gauteng, and particularly the Northern Cape, yes, is already in their third wave. The Northern Cape, for instance, never got out of the second wave, okay, and they currently have a test positivity rate of 25%, which is horrifying. Yeah. On the vaccine side of things, the number stands currently at around about 650,000 people being vaccinated. That includes the Sisonke study that was conducted, as well as the over 60s. And for us to reach that 5.5 million over 60s that we want to vaccinate before June 2021, and the 13 million people before November, we need to vaccinate round about 125,000 people per day.
Okay, now that is obviously a very, very tall task, because over 60s now get an opportunity to register and get vaccinated as we speak. That process is a little slower, as you mentioned. Challenges. Vaccinating during a pandemic has big challenges, as opposed to something that, outside a pandemic where you've got infrastructure and there are different factors that play in your favor. Not the case at the moment. So what I want to ask you is just in terms of the country itself, a third wave, what is that going to look like compared to the other waves that we've seen? Because obviously we do have some vaccinations here and there. Is the third wave, will it look the same? Will it be the same duration in the event that we get there?
Well, the one thing we did learn of COVID-19 in the last year has been it's unpredictable. Okay. So we actually don't have a clue what it's going to look like. The one thing we do know is that the current circulating variant is exactly the same one that's been circulating since November of last year. Okay. So one can probably expect a similar wave than the second wave, not worse, because there's no difference in variance. And the only thing that can flatten the curve or for us to avert this third wave is people working together. And I think the current wave has been driven by complacency, people congregating, people getting together, not wearing their masks, not sanitizing. Complacency, it's a big issue.
It is indeed, I completely agree. But let's move on to the the vaccines. Which vaccines are rotating at the moment?
Well, as we know, government secured round about 31 million dosages of the J&J vaccine. At this point in time, we struggle to get it.
Okay.
So at this point in time, people are receiving the Pfizer vaccine,
Yes.
which is completely different than the J&J vaccine because it's a messenger RNA vaccine.
Okay.
And also it's a 2-dose vaccine. And those sort of vaccines, the mRNA, quite delicate, quite sensitive vaccines that have challenging transport, storage facilities required at round about -70. And it's a frozen vaccine. So it's only defrosted at the site where it's going to be given, which means that it needs to be stored in a freezer and can be stored in a freezer, -20, for around about 30 days. And if you actually defrost it, you should use it within 5 days.
Okay.
So not a vaccine that we actually want to use in the rural setting, and probably a vaccine that will be used in the urban setting like Cape Town, Joburg, etc. Because people need to come back for a second dose. And that second dose currently will be administered round about 3 months after the first dose.
Fascinating stuff, but at least we know exactly what the situation is. I think the next step now is to find out exactly how you can register for this particular vaccine. And as the doctor mentioned, no complacency, mask up, sanitize, social distance, the same as when we started. That type of discipline is so important to avoid a situation where Uncle Cyril chats to us on the TV. So stay tuned to your Feel Good Breakfast Show. As infectious diseases specialist, Dr. Emile Reid will be telling us a bit more about the electronic vaccination data system, self-registration portal after this. So stick around, and if there are any over 60s in your household, I suggest you tell them to watch S3 in the next couple of minutes.
It's my Feel Good Breakfast Show.
Welcome back to Feel Good Breakfast Show, and what an important discussion you and I are having today, because we have to continue our health discussion this morning with infectious diseases specialist Dr. Emile Reid. He's still with us, and he's ready to answer a few questions on the coronavirus vaccine registration process. So if there's anybody in the home above 60, please tell them to get it on the TV. We're going to try and make it as practical as possible for you.
That's right. Well, Dr. Emile, this is a very exciting thing that we now get to register. Firstly, let's talk about the actual registration process, the electronic vaccination data system that's currently there for the self-registration.
So it was actually made extremely easy for everybody to follow, even the elderly. So there's 3 ways. The one way via the internet, government website, and secondly via WhatsApp, and then thirdly via SMS dial. Very, very important. So should you want to register your mother or father or anybody over the age of 60, you use one of those methods, and what will happen, you will actually get a confirmation SMS within 24 hours. And that is not your voucher. The voucher will be the next SMS that you will actually get. And that voucher will tell you exactly where and when you should go for your vaccine. And the reason why that is important, because we're dealing with over 60s here. We don't want them to stand in queues for hours and hours. We don't want them to congregate, because sometimes these events might even be a super spreader event. So you want them to actually pitch up at the correct time on the correct day. So if somehow you can't make it, you're not going to be scrapped off the list. You actually go onto the number 1 on the following list.
Okay.
So you will be bounced back. You will not be scratched off those lists.
Okay.
That is so key. Now, I'm hearing a lot of correspondence, so my assumption is that your cell phone number, you need to be sure that your cell phone number is correct. or perhaps even somebody who is readily available near to their cell phone can be the one collecting those communication for you if you are over 60.
Exactly.
So that's one thing that needs to be. What other things do we need that has to be accurate for us to make sure this process is smooth?
Well, first of all, you need your ID number.
All right.
And then, obviously, you need your address, either your work or your home address. And you need to decide, do you want to go for your vaccination during the week or over a weekend? So currently, it's been active only on a Saturday, not on a Sunday. And hopefully, we're going to have vaccinations 7 days a week from here moving forward. The reason for that is every applicant actually goes through the same system, the government system, nationally. And because your address is so important, it actually automatically decides the closest site that you can go to for your vaccine. So your address and your cell phone number, extremely important. Those people that do belong to a medical aid also need to provide their medical aid number, and that is not because you are going to get a bill, because the vaccine is free for absolutely everyone.
Yeah.
It's actually only going to be used for statistical purposes.
Okay,
good to hear.
very interesting. Because when the registrations open, because at the moment it's only 60 and older that can register, right?
Yes, correct.
So when the registrations opened, I made sure to add my mom and dad's ID numbers, register for them with their cell phone numbers. And my mom phoned me the next day to say they got their confirmation SMSs. So last week, Monday and Tuesday, they had separate days they had to go, but they got the SMS and it was very easy, straightforward with what time they needed to be where. And my mom said hers took 15 minutes.
Fantastic.
In and out.
That's amazing. And I think the other important thing is for people not to pitch up unannounced, because that will just cause complications. And remember, those sites like Dischem, Clicks,
Yes.
Discovery Health, etc., are all falling under the same banner. It's not as if they only vaccinate medical aid patients, they vaccinate everybody. So everybody is working together within the same program.
There we go. Well, Dr. Emile, thank you so much for joining us. And of course, we have those details on our screens right now. You can find the website address on where you can go and register, get more information. WhatsApp support is there as well as emergency numbers, but it's really, really easy. So if you're 60 or older, please make sure you register, you get that confirmation SMS, which is extremely important.
Absolutely. And you know what? If you are one of those techno-savvy individuals and you can help somebody over 60, now is the time to step up and assist.